Hi guys, my name is Priscilla Sutphin, and today I will be doing an informative speech on the long-term effects of Xanax and other benzodiazepines on the human body. It's to inform you guys on the psychological and physical and neurological effects of using Xanax or similar benzodiazepine medications for a prolonged period of time. Benzodiazepines like Xanax can be useful for patients for treating anxiety and stress in an acute setting, but can have detrimental effects on patients who utilize the medications for a long period of time, causing cognitive and psychological decline, dependency and withdrawal, and safety challenges posed by trying to stop taking these medications. So, imagine trusting your doctor to help you cope with anxiety. You've just went through some trauma, or you just have a lot of anxiety from, childhood, or something could have happened to you, or just stress, only to find out that the medication that was meant to help you has now caused memory erosion, physical dependency, and an alteration to your brain chemistry years later. So, we're going to talk about first, what are benzodiazepines? How do they work? So, a benzodiazepine is a central nervous system depressant used to treat anxiety, panic disorders, and stress, along with some other things like insomnia, or other sleep disruptions. There's other drugs known as Valium, Klonopin, Ativan, but most commonly we're going to focus on Xanax, because it is the most prescribed benzodiazepine there is. So, it's a central nervous system depressant. So it works by increasing that feel-good chemical. It's similar to dopamine, but it's called GABA. GABA works in your brain, and it kind of combats that fight or flight response. So it shuts that down. So if you were in fight or flight mode, it's going to help relax you. GABA, it gives the brain a calming effect. So you don't have those feelings of anxiety anymore. Or if you're having a panic attack, you can take your medication. It's going to take it away. And if you've struggled with panic attacks, you know how scary they can be. So now that we have an understanding of what benzodiazepines are, what Xanax is, and how it works on your brain, the effects of the long-term use on the body and the brain are pretty interesting. According to the ArcView Recovery, over 50 million prescriptions were written just last year for Xanax alone, not including other benzos. So, the long-term effects that doctors neglect to tell you about when they're writing you these are memory loss, cognitive degradation, weight and appetite changes, forgetfulness, impaired motor function, and even liver damage, urinary tension, and low blood pressure. Psychological problems that it causes for us. Turbulent mood swings. We're happy one minute, sad the next, mad, irritated. You never know what you're going to get. You get rebound anxiety. If you don't take your medication on time, you get rebound anxiety. Psychomotor speed reduction, trouble with attention span and concentrating, paranoia, and even depression. The things we're trying to treat are a side effect, so I took note of that. Risk significantly increased when used in combination with other drugs like opiates or alcohol, and thousands of overdoses are due to mixing benzos with these substances each year. Aside from cognitive and physical effects, something not talked about with patients is the dangers in stopping. So we're going to go over the psychological and physical dependency. Your tolerance builds over time, just like with any other controlled substance. So withdrawals can actually be deadly with benzos. We always hear about alcohol causing deadly withdrawals, but benzos are in the same category. Your tolerance builds over time, so you're going to need more and more of this drug to function. And it's not necessarily addiction, but physical dependence. Your body needs it to function. Withdrawal symptoms include insomnia, sensitivity to light, headaches, blurred vision, depression, rebound anxiety. And the worst of these, if you stop abruptly, are hallucinations, seizures, and even coma. So it's best to do your detox in a hospital setting where you can be monitored. So in conclusion, short-term use of benzodiazepines can be beneficial, but long-term has serious consequences. So we know it's a central nervous system depressant. We know it's used to treat anxiety and panic attacks. We know it causes long-term cognitive and psychological effects, especially with your memory. And now we know the dangers of coming off of this medication. And I think this should be used to bring more awareness to this medication. And I think that doctors should inform patients more because, like I said, I can speak from experience, and it's not a fun game to come off of these medications. So always do your research and stay informed, and I hope that we learned something today, and I hope that you learn about the effects of Xanax and the dangers of long-term use. Thank you.